Kuom higa ka higa mar apisas mag thieth mantiere riwruok mar apisas mag thieth e pacho kata Kenya Clinical Officers mar 25 dhi nyime kaunti ma Kisumu ka thor wach mar romono en jiwo weche mag thieth kod dongruok e kor gwenge. Romono mar ndalo adek ochakore kawuono e kaunti ma Kisumu ka bende jokanyo ma kwan gi ohewo apisas 1,000 chano mar twak yore mag bero weche mag thieth ahinya to e bwo chenro mar piny owacho mamalo mar UHC. Wadani wawinjane kaka weche obedo e romono ma bende ochakore ayanga e gwenge ma Kisumu.
And joy to be able to join you at your 25th annual scientific conference, whose theme, strengthening primary health care for sustainable development, really is in sync with the government's theme of providing universal health coverage through a primary health care approach. Again, your theme is very well linked to the sustainable development goals and our long-term vision 2030, and also the bottom-up economic transformation agenda, which promises to improve the health of Kenyan people. Dr. Ganda has spoken articulately, and also Professor and other speakers, about why we should go primary health care. It is a gold standard as to how universal health coverage can be delivered. If you look at the countries that have made progress and have achieved universal health coverage, which is a journey and not an event, those countries have basically invested in primary health care. And the advantages of investing in primary health care are huge. Primary health care services are usually comprehensive, they're integrated, they promote equity, inclusivity, and participation of communities. That is why, as a country, we have decided to take a backflip as to what we are doing previously in terms of health delivery in this country, which was mainly focused on curative health services. And curative health services is a bottomless pit. You pump billions and billions and billions, but your health outcomes in terms of the indicators will never change much. Coming in a space when we have difficulties in the global community, economic community, the war in Ukraine, Russia, now what is coming up in the Middle East, rising fuel prices, rising cost of food, economic stagnation, what best approach should we take is to go back to the basics, go back to promotive, preventive healthcare services, which also has been scientifically proven that any investments made in primary healthcare services has a huge multiplier effect in terms of the outcomes. So with the challenges that we face, we have no option but to go primary healthcare services. We also saw during the COVID-19 pandemic, countries that had strong and resilient primary healthcare services tended to perform better than those that relied essentially on curative health services. That, as a result, is why, as a government, we are committed to focus on primary health care services to deliver universal health coverage. It is only 1 month ago when His Excellency the President flagged off the community health promoter